Are you seeing? Are you hearing? Okay. Welcome again, Ahmed.
Okay, mister. Everything is okay.
Welcome again. What is Fry's syndrome, Ahmed?
والله نسيها يا mister.
Okay. يبقى after describing of the explaining for the patient, يبقى أهم حاجة في الكونسنت to start by introducing yourself, grading the patient, taking permission. You have to ask the patient if he wants to have somebody with him or he has to have some privacy. After that, you ask the patient what he knows about his disease and the proposed operation. And then you fill in the gaps, you describe for him everything from the preoperative, from the diagnosis to the preoperative assessment for the surgery, for the complication and the expected outcome, the expected complication, how he will be off work, how much he will be off work. Then you ask the patient if you have any question. If he has no questions, then you will ask him if he understood everything or he need another more information or he need another second opinion. Okay. After the patient is satisfied, then he will sign a consent. Uh, he's agreeing to have the surgery. Okay. في overall assessment is the candidate poor, good, or excellent. This is the part of subjectivity. Okay. As you have said, medicine cannot run without some subjectivity. Okay. So the subjectivity is looked for, is given 4 marks out of 20 actually in this station. Okay. Any questions? Okay. Any questions? This is regarding counseling. If you come to counseling, the patient is asking you, not you are not going to the patient. The patient is counseling you, or the patient has a problem.
يا دكتور.
Yeah.
لو في الامتحان يعني البيشنت قام قال لنا انه عنده كونسيرن عن الكومبليكيشن بتاعت السيرجري، نرد له كيف يعني؟
Okay, he has the right to consent to know he's not happy about the complication. Then you have to tell him if you don't do the operation. ما ده اتكلمنا the other options. ما في حته اتكلمنا عن other options. If you don't do the operations, this will happen to you and that will happen to you, and you have to know that. Okay?
ايوه تمام.
Complication if he don't accept the surgery, what are the other option? If there is other options, you have to tell him about. If there is no other option, you have to tell him if you don't do the operations, then you will have the complication of the disease. The disease may, if it is malignancy, it may spread, it may have meds, and so on and so forth. Okay?
ايوه تمام تمام.
Yeah, you get it.
ايوه شكرا.
The same parameters or the same things apply to the counseling and apply to the breaking bad news. Very important in breaking bad news, not to lie on the patient, not to give the patient lies. Okay? Don't lie. In taking consent, in counseling, in breaking bad news, lies are not allowed. Okay? And we tend to say to the patient, this is a very minor thing. It is not minor, then this is a lie. Okay?
Okay.
Don't lie. Don't tell the patient lies. Okay?
Okay.
Come to the examination skills, which show you 3 common conditions that is examined usually routinely: breast examination, hernia examination, and abdominal examination. Ma'ab Shamsuddin, what are you doing? What are you going to ask? Yes.
معلش يا مستر، شنو التوبكس اللي بالكونسلنج زي شنو مثلا؟
الكونسلنج yes. Yes.
زي شنو التوبكس اللي بتجينا في
usually in surgery counseling is not much, but in general مثلا the patient he has HIV or hepatitis and he wants to marry. Okay, this is an example. Okay.
Okay.
Or a patient has a problem, he has to do something, he will counsel you. This is what counseling. Or in Osce and gynae, a married couple will come to you for counseling. They haven't conceived, they have no kids, the lady is not getting pregnant. Okay,
Okay.
what to do. This counseling. Okay.
تمام.
Okay, map. Then we move for examination. The first examination, it's about the general, the common problems in surgery. Actually, breast, neck examination, thyroid examination, hernias examination, lumps. Lumps, you know how to examine for a lump, مش كده? The basic things: size, surface, consistency, lymph nodes, regional lymph nodes, and the skin. The skin, the size, the shape, the size, the shape, the size, the shape, the skin, and the surface, and the consistency, and the regional lymph nodes, and the deep structures. This كلها, in examining a lump, you have to apply these 7 or 8 things to examine a lump. Examining a hernia, we'll come to it. Examining a breast lump, we come to. Now we'll talk about examining a breast lump. Okay. Yes. Now we are seeing the breast examination. Yes.
Yes.
This is also, this is long time ago, actually 10 years. I don't know, 10 years is not long now. Okay. This is how you examine. Examination, observe the candidate while he's examining a simulator in the breast lump. Gibna can simulator have a breast lump actually. Usually, Osce is made to avoid bringing patients to the examination. Okay, you see this. Okay, the aim of the session to assess the adequacy of clinical examination of a breast lump. يبقى عنده الهدف الاساسي بتاع الستيشن دي ان is this candidate is fit or having a fit skill to examine a breast lump. بنبدا بالاتيتيود زي ما عارفين اي حاجه في عشان كده الاتيتيود مهم. Introduce himself and ask for permission. Right position and exposure. Attempt to examine the normal place first. ده مهم كله بياخد عليه درجه. Science symmetry of the breast اللي هي بادئ بالانسبكشن. Are the breast symmetrical, skin over them, nipple and areolar complex, ulcers, pseudo-orange, nipple discharge, fungating mass. Then we'll come to the palpation. Surface, temperature, tenderness, 6 quadrant palpation will give 4 لأنه ده مهم. Consistency of the lump, mobility, fixity to the skin, fixity to the pectoral muscle to underlying structures. 4. Examination of the axilla, neck, and supraclavicular region زي ما عارفين 4. Okay, the total. Okay, this is how you assess a student for examining a breast lump. Any questions so far? Okay, any question? Okay, we'll come to the inguinal hernia as it is an example for all types of hernia. Actually, inguinal hernia is, can you see? This is the page of instructions to the candidate. Examine the right inguinal region of this gentleman. Talk while you are examining the patient. That to show your signs while you are examining, because there is no time. The time may finish while you are doing your examination. So you have to tell your finding immediately. You've got steps: wash hands if there is any area of washing. If there is no, then you have to tell the examiner that I want to wash my hands. Okay. Introduce himself, grade the patient, and take permission. اوكي ووش 1 2 3 4 عندها 4 درجات كل واحده بدرجه. Ensure privacy, proper positioning and adequate exposure. Identify the affected site and extension. Positive expansile cuffing impulse دي مهمه جدا to diagnose. If not done, لاحظوا if not done ادينا كم؟ If not done الفوق كله ينصفر، لكن هنا ادينا كم if not done؟
-2.
-2 because this is a very fatal mistake. Actually, see, you can, although this is not really agreed upon, it's not really, but marking with negative in missing a very important, basic, critical information sometimes is allowed. Okay? Reducibility test, برضه بنديه 2, لكن if he didn't do it, it is -2. Performing deep ring occlusion, direct or indirect inguinal hernia, 4, لكن if he didn't do it, it is -2. Palpation of the spermatic cord to see the swelling above or below the testicle, مش كده؟ عشان to see if it is a hydrocele or a hernia. Examination of the other inguinal side and other hernia orifices. Examination of the abdomen for masses or ascites. This will predispose to a hernia formation. The rectal examination for prostate, مش كده؟ You may not allow to do it, like you have to mention for the examiner, I want to do a BR. Examination of the chest, as you know, chronic cough is one of the conditions that favor hernia. Okay, برضو is overall, if it is a poor, then -2. If it is a good, then 2. If it is an excellent, then 4. This is another place for subjectivity. Okay, the impression of the examiner, it's not that subjectivity per se, عشان ما تزعلوا. It is not subjectivity per se, but the feeling, the impression of the examiner about you, the overall impression. And as you know, some of the patients, they come to you in the clinic, and when you see them, next time they will never come to you. So the impression of the patient or the examiner in front of you is very important in medicine. Okay, so it's not a bad thing to have 4 marks for the overall impression or overall assessment of the examiner. Okay, any questions? This apply to the inguinal hernia, actually, I can apply with some modification to other hernias. Any questions so far? Okay. Okay. If there is no questions, then we'll move to the last examination skill, is the abdominal examination. Abdominal examination. And this is, as you know, abdominal examination is very important in surgery or in medicine in general. Examine the abdomen of this patient, talk while you are examining. In any examination station, you have to give your findings immediately because the examiner will check, identify that the patient is in correct position. You have to know that it said you have to grade the patient, you have to shake hands with the patient, you have to introduce yourself, and you have to take permission. دي number 1. احنا الان بعدين بنمبر 2 مش كده؟ So the checklist is starting from 2. You get that?
Yes.
Number 1 is the basic information. عارفينها انتوا, introduce yourself, you shake hands with the patients. You sometimes nowadays you cannot shake hands with the patient because of the corona and so on, so you don't need to shake, but you grade the patient, you introduce yourself, and you take permission. Then you come to the second step, identify that the patient is in correct position and comfortable. The best position for examining the abdomen is the patient lying supine, مش كده؟ Caring of the patient privacy and dressing but covering patient sufficiently. Examination of the hand for stigmata of chronic liver disease, spoon shape, white nails, flapping tremor, pulse, blood pressure. Inspection, general, paleness, jaundice, cervical lymph nodes, parotid swelling, chest for hair distribution, gynecomastia, spider nevi. Inspection, normal, distended movement, visible peristalsis, coughing impulse, positive or negative, hernia orifices, superficial palpation. You know, this is a typical case of abdominal examination. Superficial palpation for tenderness and temperature and tenderness and superficial bulbal masses. Examination of the spleen, examination of the liver span. Okay, bimanual palpation of the kidney. As you know, liver span is done by tidal percussion, as you know. Auscultation for the liver ممكن يكون فيه بروي، ممكن يكون فيه venous hum. By manually palpation for the kidneys, palpate for the paraortic lymph nodes, shifting dullness for ascites, or if there is a major ascites, massive ascites, fluid thrill. Listen to bowel sound in different cases. Look at the genitalia. مش كده؟ You have to look at the genitalia for inner abdominal scrotal swelling, scrotal examination, and doing a BR is very mandatory in inner abdominal examination. Lower limb edema. If there is an abdominal mass, you have to describe the mass, the size, the shape, the size, the shape, the mobility, consistency, percussion, etc. Okay. Overall, the overall assessment of the technique, is it poor, is it good, it's excellent. Okay. Okay, any questions so far?
يا مستر البارا اورتيك lymph node فبرضه بنعمله ولا
If the patient is slim, very slim, then you can do it. Okay.
okay thank you.
Okay. Any questions? This is in brief, actually. This is in brief. And you see, Mr. Abdullah, Mr. Yasir Hanafi are observing a candidate while doing examination. Okay. It is very fair to have two examiners, مش كده? But usually in the Osce, the role of the examiner is very minimum, so we don't need to. We have minimized the subjectivity by putting a checklist. Okay, so the examiner has to check on the list. He has nothing to have to do subjectivity. So the minimizing subjectivity, sometimes you need two examiners when the exam is not controlled by checklist. But why when the exam is controlled by checklist, sometimes you don't need the two examiners. Okay, because the checklist will eliminate the subjectivity. Okay. Any questions?
كان في
Are you seeing
كان في
this?
بوينت يا مستر في الكونسنت
Yeah. Yes. What is it?
انه giving your signature on the consent doesn't mean that you have to undergo the surgery or something like that.
Yeah. Yes. ممكن تغير رأيك في أي وقت. ما it's not obligatory. يعني ما ماضي ما زي الشيك مثلا. ما زي الشيك، انت مضيت الشيك you have to pay القروش اللي مضيتها في الشيك، صح؟ لكن signing a
Okay,
consent
and I have
ما
to
يلزم انك
advise
انت
this
تدير العمليه.
point to the patient.
ايوه،
Okay.
انه انت مضيت هنا ما معناه ان العمليه دي اجباري عليك. It's not obligatory. بعد ده ممكن تغير رايك وتمشي ما تعملها. You get it? It's not obligatory انك تدوز السيريال. ما معناه انك مضيت على الكونسنت
Yes.
معناه انت ملزم تعمل العمليه. You get it? You are not obliged to do the operation. ما زي تمضي شيك ما عند الناس انك زي مضيت شيك. تمضي شيك you have to pay an amount of money اللي مضيتها في الشيك، مش كده؟
Yes, I get
لكن
it.
هنا اسمه you get the point. Okay. Any questions? Ahmed?
No, Mister, thank you.
أحمد عايش
the-
طلع ولا شنو؟
Duration
البوست
of station.
Yes, this is one of the important things in constructing a station to give a time. The time according to the task. Okay?
Okay.
They do, the examiner, they sit together, they have a control panel, they sit together and they think this station is 5 minutes, this 10 minutes, this 6 minutes. So students in the student level, in your level, undergraduate level, will put same time for all the station. It is just 6 to 7 minutes. It is 6 to 7 minutes. Okay? standard. The examiners will try their best to put the stations to be answered or to be fulfilled, the task to be fulfilled in 5 minutes. 1 minute, 1 minute extra. It's 6 minutes, but usually you can end the station in 5 minutes. Okay?
Okay.
Sometimes we'll have a station of history followed by discussion. History or discussion. Okay? You take the history, مثلا, of a gallbladder disease or a breast lump, then you come to the next station to have discussion on this history. What is your differential diagnosis? What's your plan of management investigation you will do? What expected outcome of this investigation? What are you going to do for this patient? And what is the management? And so discussion. Okay? This part of the communication stations, that is, after taking the history, you will have a discussion on a separate station. Okay?
Okay, good.
If there is no question, Ahmed can stop recording.